No.
Good afternoon. My name is Diane Hank, and I'm the Director of Workforce Transformation here at OPWDD, not W radio station. So welcome, and thank you for joining us today. And again, thank you for your patience. For this info session, we just want to remind before we get started that all the previous sessions are posted on the OPWDD website. You'll see the link there on your screen. The sessions for June 6th and 20th, the topics are being determined now. The reason being for that, we wanted to be as responsive as possible to the different issues that are arising from the field so that we can respond to those and share with you the answers to the questions that you have. Today, for this info session, we are continuing sort of a part 2 or 2.0 of answering questions we're finding to be asked most frequently by our MSCs. So without any further delay, I'll hand it over to Kate Marley from the Division of Person-Centered Support. Go ahead, Kate. Thanks.
Good afternoon, everybody. So we want to get started and just make sure that everyone is aware that of the resources that are available. So you'll see on this slide that we have trainings that are available, transitioning to CCOs, what MSCs need to know and do. That's available on the statewide learning management system, and we have certainly been watching the participation through that venue, and it has been excellent. So we're convinced that most people are taking advantage of that, but just so folks are aware, that is a resource that is available. Also available on that platform is a Medicaid coordinate module. That is information about the IT systems that the various CCOs will be using, and there's training available on that. Finally, we also have the MSC Toolkit. That was one of the very special topics that we focused in on through this series, and it includes lots of information which we think will be very helpful for folks, including the brochure, the CCO coverage chart, and other resources that we've been discussing in the past weeks. So there is something that I wanted to make sure folks were aware of, that there are new resources in the last week or so, which we think will be very, very helpful for folks. First of all, there is a resource guide. This is a guide for service coordinators. It's kind of your go-to packet that you can take with you when you go to meet with individuals and families to help you walk through the process. It contains all the information that you need to successfully navigate and assist people with the enrollment process and the choices they need to make. So we sort of pulled together all the resources that have been out there into one sort of handy-dandy toolkit, and that is something that you all should have received and is available for you as well.
Be posted by the end of the week.
Okay, so it will be posted by the end of the week on the OPWDD website. So that is being disseminated, and we will certainly reach out to the folks on this call and make sure that they're aware when that has been posted. Also, we have frequently asked questions. That's a compilation of the questions that have come in both to various mailboxes, mostly at OPWDD, but also with our colleagues at the Department of Health, and also certainly from some of the sessions that we've done, these lunchtime learning sessions. Questions have come in, and we sort of compiled them and responded to the most frequently asked questions. And that is a resource that is available on our OPWDD webpage, and will in fact be sort of the source guide, if you will, for some of the questions that we will be walking through this morning. We're actually drawing from that document, and we're going to spend the next half hour or so kind of looking at the questions that have come in with most frequency and address those during the presentation. And then obviously if there's further questions, we'll have some time to take questions at the end of that presentation. So moving into the questions and answers, the first one is there a change in frequency of the Medicaid Service Coordinator visitation? So today there is requirements under Medicaid Service Coordination for contacts with individuals and families, face-to-face contacts through that program. And what we outline here are the new requirements going forward. So for the Health Home Service, for the Health Home Care Management Service, The care manager needs to document one of the health home core services each month. Now, that does not necessarily have to be a face-to-face service, but it does have to be one of the core services. In addition to that, there has to be a face-to-face visit with each person on the caseload at least once per quarter. And however, it should be noted that there are certain people for whom are included in what we call the highest tier, so that's tier 4, and those are for people with the greatest care management needs and includes all members of the Willowbrook class. For that subset of individuals, there will need to be a monthly face-to-face visit with the person, but that is sort of a narrower scope of individuals and is enrolled in the program overall. The frequency of contact for the care manager beyond those minimum requirements, just as today, is really determined as part of the person-centered planning process. So obviously, if a person needs more, the care manager would be expected to meet with the individual and or family as needed to address whatever concerns are present, and of course, just like today, always to be present via phone or in other methods as needed to make sure that the person is getting the services they need and is healthy and safe and receiving the kinds of supports that they want to be receiving. So we've also had a lot of questions about what happens when a person selects a CCO that is not affiliated with the current Medicaid service coordination provider. So this would be an example where the today's Medicaid service coordinator works for an agency that, for example, has affiliated with a particular CCO, but the individual opts to receive another one, receive health home services from a different CCO. That's absolutely fine, and of course the whole point of the enrollment process and the consent process and the decision making is that people always have a free choice of available providers. It is the role of the Medicaid service coordinator to assist that person to express their choice, whatever that choice is. So for the Medicaid service coordinator who is informed by the individual or family that they choose a different CCO, they will have to work with the person to complete the forms that will designate the different CCO, and then they will need to make sure that the consent forms and the other supporting documentation is mailed to the CCO that the person has selected to work with after July 1. In that frequently asked questions document that we cited earlier that is available on our website, we provide the CCO addresses so that folks can know where those documents should be sent. Okay, I think one of the very early questions we've had, and we have addressed it, I think, in most of our presentations since we started this series, was a request that we clarify the qualifications for the basic HCBS plan support. So, basic HCBS plan support is a service that is available to anyone who is enrolled in Medicaid, is eligible for OPWD services, and meets the ICF level of care. So any individual who today is enrolled in Medicaid service coordination or in plan of care support services can choose either option. Okay, we've been, I think, and hope, very clear and consistent in that message. Everyone who today receives MSC or PCSS has the choice of those two options, either enrolling in the health home or enrolling in the basic HCBS plan support. And of course, part of the work of the care manager is to, and the Medicaid service coordinator is to work with them to help them understand the differences and make that choice. So the question is, for people who are currently in services, what is the effective date of service if a person chooses a different care management provider or service type? So for everybody, the effective date of the new service is going to be July 1, 2018. So if a person is currently in services getting either Medicaid service coordination or plan of care support services or is newly being enrolled as we speak, the effective date for the CCO Health Home Care Management Service will be July 1, 2018. After July 1, 2018, so once we make that transition, a person continues to have the right to make a choice of CCO, a different choice of CCO, or a different choice of care management service. And once we pass the July 1 date, the effective date will be the first day of the month following the person's request. So that's just like it is today. The Health Home Care Management and the basic HCBS plan support are both monthly services, just like MSC is today, and the effective date is the first date of the month following the month for request. And again, individuals can always make that change. It is a voluntary program, and changes can be made at any time should they choose to do so. So we also had a question asking that we clarify the statement transitioning to care management. MSCs need what MSCs need to know and do. In that training, we stated individuals who are currently receiving either MSC or PCSS and do not currently have HCBS waiver services are not required to be waiver enrolled to enroll in a CCO health home. So that's true, and we did just specify that anyone today who is enrolled in MSC or Plan of Care Support Services can choose either the Health Home Care Management or they can choose the basic HCBS plan support. Okay, so that is the population who is eligible to make the choice between those two types of service. The issue that we have is that HCBS service requirements require that any person who is receiving HCBS waiver services must have a care plan that is developed, monitored, and reviewed with the support of a care manager. Therefore, an individual who receives waiver services has to select one of those two options, either the Health Home Care Management or the basic HCBS plan support. An individual who is not receiving waiver services, so for the person who is Medicaid eligible, OPWDD eligible, and ICF level of care, but not receiving waiver services, may elect to opt out of care management services. We would hope they do not, but they may do so. They have both options, but what we need to be careful about is that people need to have a care plan to continue their HCBS waiver services, and that's why it's so important that people understand that opting out altogether will ultimately affect their ability to continue to receive HCBS waiver services. Okay, another question that we've received is that the checklist requires an individual and or family representative signature at the end. The question is, when should this be signed by the family? If signed by the family, what about families who live in another state or families who are unable to meet face-to-face? So the checklist is completed for those who choose to enroll in the Health Home Care Management Service. I think that's sort of a basic fundamental building block that we want to make sure folks understand. So if somebody opts into the basic HCBS plan support, that form does not need to be completed. The checklist may be completed and signed at any time the consents are signed, or if the current MSC is trained in health home services and will transition to the CCO care manager role. So that's another important distinction. If a care manager or a service coordinator today is assisting an individual or family with enrollment, but will not be continuing on as a CCO care manager, then it's more appropriate that the person's CCO care manager complete that form at the time that services start. So that's why you'll see in the third bullet that what we are allowing is that checklist can be completed anywhere between April 1st, when we started the enrollment process, through the end of the first month of CCO services, so through July 31st, 2018. So that would allow for those instances where today's Medicaid service coordinator is working with a family, but will not be continuing on. The person's care manager, once they transition to the CCO health home, would complete that form with the person, because it's really about educating the individual and family about the new services that are available under the more expansive health home model. The form should be signed by the individual and or his or her family or representative when the checklist is reviewed and completed with the care manager. If the individual is unable to sign and the family or representative is unavailable or unresponsive, the care manager should document that in the form, but continue on. We've also had a lot of questions about whether the consent forms will be provided in Spanish as well as other languages, and will there be a link to consent in other languages. We certainly recognize that effective communication is a critical piece of this enrollment process, and that culturally competent care is at the very highest level of importance. The consent forms are translated into 7 languages, including Spanish. We are now working with the Department of Health to get those translated, and we will have those in people's hands as quickly as is possible. There were minor changes that are being made to update those forms, and those will be available. Once available, and we anticipate those any day now, they will be on the DOH website. We will mail them to every Medicaid service coordinator and make sure that they are widely distributed. MSC providers should continue to use and implement their agency's language access plan until these documents become available. So if that's discussing the program with the person in their native language, that would be fine, or if there's other ways that your agency supports that exchange of information and education, that will be helpful. We also want to point out that there are resources that are available for language access on our website, and we provide a link there. But it's clearly the very highest priority is to get those forms in people's hands, and we hope to do so within the next few days. So the next question that we've frequently gotten is, can an advocate make the choice for a person to enroll in a CCO? So an advocate cannot make the enrollment decision for a person. Individuals who make their own decisions should make the choice of enrollment in a CCO, and if they need support to do so, you should follow the process as it works now as you work with people related to their decision. What if the individual or other decision maker is unable to meet in person? Can we have them choose their CCO plan support and sign the consent by email or by postal mail? So decision makers must be provided with education, choice of care management service, choice of CCOs in the region, and consent forms. Original consent forms can be sent via the postal service back to the CCO designee. These actions can take place in either a face-to-face or over the phone.
We go now?
Yeah.
Okay. We do have some slides later talking about the decision-making process, which I think we will skip to. Do we know where those?
Yep, we'll skip to those.
We've had some feedback from our various offices on how the decision-making process is going. For some background information, on May 4th, OPWDD has sent an email to MSC agency CEOs that outline the steps in obtaining decisions in lieu when decision makers weren't readily available. And in the initial email, it included the attachments of the decision-making memo, the MSC tracker for enrollment, and the DDRO, DDSO contact information, as well as CCO contact information. So next slide, please. So within this, there we go. So some of the concerns that have been coming back is incomplete packets, or packets that just aren't completed appropriately, or things being sent in when they shouldn't be sent in. So I'll speak briefly to what needs to be included and what was included in that memo. The packets that are going to the CEO of the voluntary residential agencies, the directors of the DDSO and the DDRO should include the person's current individualized service plan, or ISP, the individualized information letter that contains the person's name and, in most cases, who the MSC agency is affiliating with, the consent forms for both the health home and basic HCBS plan support, and the documentation of efforts to be that were to obtain a decision from the appropriate decision maker when appropriate. There have been some questions that came in regarding how MSC should be documenting that, and we haven't really prescribed how the MSC should be documenting that. So our suggestion is that the documentation can include MSC notes or a form developed by the MSC agency to be included in the person's packet, so it's easily recognizable the efforts that were made. Also, please be sure that 3 attempts have been made to contact decision makers when decision makers are available. And so the ultimate decision maker, the CEO or the directors, can easily identify that those attempts have been made. Next slide, please. Also, we talked about how the tracker was attached to this email. The tracker is really a great tool for both the MSC agencies and those that ultimately have to make the decision to ensure that they have everything and they know who everybody is waiting on. So the MSC agency CEO must provide a spreadsheet to each agency identifying the individuals in need of a decision from the agency. The MSC agency CEO will submit all information, including the packets of information for each individual in need of a decision, to the residential provider agency CEO, DDSO director, or DDRO director. And based on the number of inquiries, OPWDD will be developing a more in-depth training on this to be done via webinar in hopefully the very near future. And I also just want to state the MSC agency should only be sending one submission to the decision makers, be it the agency CEO, the DDSO director, the DDRO director, which includes all the packets for all the individuals that those people will need to be making decisions for. So I hope that clarifies some things, but again, we will hopefully be doing a more in-depth training in the very near future regarding this.
So thank you very much. I thought it was important that we sort of look at the process that happens when someone can't make that, but we just wanted to hit on a final question that has come in. And again, these are all addressed in the frequently asked questions that are posted on our website. The question that we've received is what happens if a person is capable of making a decision but refuses to sign up with the CCO in his or her region. So basically, as we've said, it's very important that people that receive HCBS waiver services make a choice, because their continued ability to access HCBS waiver services is dependent on having a care manager and a care plan that describes those services. So you will need to follow the process that was outlined earlier. The MSC is responsible for making sure that the individual or family understands that waiver services will not continue if they choose not to enroll in one of those services. People can make that choice, but there's going to be real repercussions ultimately for an individual who today relies upon HCBS waiver services. They have to opt into one of those two services to make sure that they have a care plan that continues to support the HCBS waiver services that they receive. So with that, I think we have reached the end of the questions that we have outlined. So we'll just take a minute pause here. If there's any questions that have come in, we can address those.
I apologize about the delay. We're just reviewing the questions. It'll be one more moment.
Regarding the decision-maker process, when should the packets be sent to the DDSOO or DDRO directors by, if the individuals need their consent?
If the necessary consent forms are not completed and received by June 1st, the MSP provider must determine the appropriate agency CEO, DDSOO director, or the DDRO director authorized to make enrollment decisions. But I also want to point out, too, that if somebody lives in a voluntary residential, just because of how that question was asked, if somebody lives in a voluntary residential setting, it should be going to the executive director of the voluntary residential center. So not all decisions should be made by the DDRO or DDSO directors.
Regarding the adult consent form, the DOH 5055, on page 2 at the top, it asks for the patient's initials. Is this for the individual's initials or the initials of the person signing/consenting on their behalf?
It should be completed with the individual receiving services initials.
If parents choose to enroll in the health home, what if they do not want to list their primary care provider on the consent form?
So we've been advised by the Department of Health that the primary care physician does need to be identified on the form. Again, that's really tying back to the health and safety requirements that we have to receive to be able to deliver HCBS waiver services to individuals. It does not necessarily mean that an individual's care plan is shared with the PCP unless the person wants or needs that to happen. But it does mean that the care manager can reach out to the PCP if needed to support the care management services the person receives.
Can you provide some clarification regarding the checklist? Does it need to be signed by the individual or family representative, or is this considered best practice?
So it must be signed by the care manager, and again, that's the care manager who will be supporting the person within the CCO health home. It is certainly best practice to have it signed by the individual and family, but as we discussed in the earlier slide, if that cannot be done, then it is acceptable for the care manager to sign and then to make a note as to why the signature could not be obtained for the individual or the family.
Does every item on the checklist have to be checked off?
Yes. The point of the checklist is really to make sure as we transition to the new service model and while we are working toward everybody having a life plan, that people are aware of the new expanded services that are available to them under the health home. So it's really a checklist that serves as a tool to make sure that that education has happened and that people understand that there is a new wider scope of services available. So yes, everything should be checked.
Regarding the Choices application, where can we find the updated Choices user authorization ID form?
Okay, the Choices User Authorization ID form, an MSP will need to contact their CCO representative to obtain the appropriate and correct UAR, which is the User Authorization Form. CCO representatives will provide MSPs with the correct form, and the CCO must sign the form to ensure access. So the MSP will get the form from their CCO that they're going to work with. They will fill it out and have to return it back to the CCO so the CCO can submit it for final approval and authorization.
What happens if an MSP mistakenly enrolls someone in the wrong CCO in Choices?
So what counts in Choices is the most recent enrollment. So if you made a mistake, then as soon as you realize that mistake, you need to go back and enter in the new corrected information. It will basically overwrite, and that's my non-technical explanation of how it works, but it will eliminate the previous incorrect entry, and then that will be recognized in the system.
Currently, we submit an MSC1 and DDP1 for new cases coming from the admissions process. What will we be submitting for new people coming through on and after 7/1? How can we put them into choices?
So as of the middle of June, new forms will be available for new people not currently receiving MSC or PCSS that need to be enrolled into CCOs. So there will be new forms that will be available for the completion of enrollment into the CCO and the chosen care management service the individual would like.
Can you please clarify, everyone will now require an LCED to be enrolled in a CCO, even if choosing to enroll in basic HCBS plan support?
Yes, everybody will require a level of care to be completed regardless of if they're receiving a waiver service or not. There is a time frame in which that level of care can be completed, so you can work with the CCO that you're going to be employed with to have them completed for people that do not have a level of care on file today.
Regarding the annual ISP dates to convert them into life plans, how do we proceed with the semi-annual ISP review meetings?
So we have given guidance that it is recommended that MSCs follow the current review schedule for an individual unless the individual requests a change in that timeline, or if there's something that warrants a review to be held. But there is, for individuals in tiers 1, 2, and 3, you have 12 months to have the life plan developed. We anticipate that would fall on the annual review schedule. And for individuals in tier 4, you have 6 months to have it moved from the ISP to the life plan.
Going back to the checklist, can you please clarify who completes the checklist? Is it the MSC or the care manager?
So the basic premise here is that let's go back to what the purpose of the form is. The purpose of the form is to make sure that as we start this new, more expansive service, that people understand the services that they can ask for and what is available under the health home model. So it should be completed by the person who will be working most closely with them in the CCO health home, their CCO health home care manager. In most cases, we would anticipate that the person's CCO health home care manager is in fact their MSC service coordinator today. If that is the case, then the MSC service coordinator can complete that form at the point of enrollment if they choose to do so. So they can be doing it as an MSC service coordinator because they will be the CCO health home care manager. If, however, the person's current MSC agency or service coordinator is not going to be transitioning to the role of the health home care manager, then it's appropriate that the person's assigned health home care manager complete that form after July 1st. That's why we have that date range for completion of those forms at the start, prior to the initiation of health home services and also the first month of health home services.
Do addendums have to be completed to identify the individual's chosen CCO as a provider effective July 1?
No, addendums are not necessary for people who are opting into the health home service. The completion of the checklist is going to serve as an addendum that identifies the CCO and the health home care management service. So that is the addendum to the ISP that documents that that choice has been made and includes it in the ISP.
And for individuals who choose to enroll in basic HCBS plan support, that consent form would qualify as the addendum for that service.
Going back to the decision-maker process, can an individual make a choice if he or she has a legal guardian?
For individuals who have a legal guardians have to make that choice.
Is the Medicaid training available in SLMS?
Yes, the Medicare Training is available in SLMS, and on the OPWDD website, you can find the instructions on how to log into SLMS and create an account if you haven't already done so. And then when you get into SLMS, you can find the Medicaid Training. I will also send out an advisory with the details on the name of the training and how to get there following this meeting.
Thank you. And just to clarify again regarding a person who is now 17 but will be turning 18 before July 1, they will sign the adult consent form.
Correct. So for individuals who will be 18, they should sign the adult form.
If a care manager is with one CCO and then the individual wants another CCO, would that care manager still be able to serve them, or would they have to go with a different care manager from the CCO they selected?
Right. So if a person, and that's an important point of clarification, if today's Medicaid service coordinator is working for one CCO and the person selects a different CCO, then the person is selecting a different CCO, but they're also making the choice to work with a different care manager. So when that change happens, the CCO that they have selected will assign a care manager to work with them at that point.
Will the resource guide also be shared via MSC eVisory?
Yes, once the resource guide is posted to the OPWDD website, I will follow up with an advisory providing that link and notification that it's posted.
So to clarify, if there is a relative that's currently listed on the ISP, we need to document proof of attempts to contact that person prior to submitting the packets for decision making.
If there is a relative that typically supports the person in terms of decision making, then yes, it would be appropriate that you try to reach out to them to support the decision making if somebody needs to help that decision making happen, and the service coordinator should document that in accordance with the instructions that were provided earlier. So it could be a note, it could be another form or format, but we do want to make sure that every reasonable attempt is made to support decision making for those people who need that support.
What RIO do we put down if the physician is out of state?
The physician out of state doesn't affect the RIO selection. So the question and answer document includes information on RIOs. The RIOs are based on the CCO having a relationship with that RIO and the county in which a person resides. So you would use that as the information source even if the person receives physician services out of state.
Can you clarify whether agencies can bill for face-to-face contact with an individual enrolled in PCSS for the purposes of CCO-informed choice making and the signing of consent?
So we have said that any MSC activities that you're doing today that involve consent and education around CCOs and the completion of consent, if you review the requirements for List A and List B activities for MSC billing, they do meet those requirements. You still, for List A, would have to do a face-to-face for the education and completion of those consent forms. If you were to mail them and have a conversation over the phone, then you would start falling into the List B activities, and you would still need to complete 2 List B activities to bill. However, those requirements and rules still apply.
And for the individual who's enrolled in Plan of Care Support Services,
the same applies just as it does today. So List A and List B activities. So yes.
If somebody is having a difficult time completing the CCO selection form and choices, who is a contact? Is there a mailbox?
If you go to the choices page on the OPWDD website, there are choices liaisons in every region of the state, and you can contact your choices liaison if you're having technical difficulties. If it's beyond technical difficulties and of getting into choices, you can reach out to myself. This is Angie, and I can help you complete it.
I just want to clarify, there was a question about whether legal guardians had to sign if there is one assigned. So if a person has a legal guardian, that person legally is their decision maker. However, it follows the same flow that we discussed if the legal guardian is not available. So if you cannot contact them, you need to follow the same process and the same decision-making flow that we've discussed, and to reach out to them and make sure that you notify the DDRO to move forward in the decision-making process. So the question is, if an individual is receiving home care services through CDPAP, which is a Consumer-Directed Personal Assistance Program, which is self-directed personal care, can they be enrolled in a CCO health home? Yes, they can. So that is a state plan service that some of individuals with IDD may be receiving. If you are receiving that service, you can be enrolled in the CCO health home. Just like today, people who are enrolled in CDPAP who are OPWDD eligible will typically receive Medicaid service coordination or plan of care support services. So as long as you meet those criteria, you would need to make that selection.
We're just taking a moment to go through some of the questions.
So we also had a question seeking clarification about the Medicare training that is on the SLMS system. That is certainly available to everybody, but you should check with the CCO with which you are working. Several of the CCOs have other systems where training is also available, so you should seek clarification from them as to the training that is available on SLMS versus their own online learning management systems.
Okay, just be one more moment while we review some more questions.
You have to read it. Okay, thanks for holding. We did have a question that again related to an individual making a different choice than they had previously made related to a CCO. So if an individual comes to you and says, you know, now I want a different CCO, that's fine, they can make that choice. The new forms need to be completed. You need to follow the process as is outlined. and that new choice needs to be documented in choices. When that happens, that will override the previous choices entry. So it will eliminate the previous choice that was made, and the new one will be reflected.
Can somebody who is currently self-directing their services choose to enroll in the basic HCBS?
So people who self-direct their services are waiver enrolled, so they must make the choice, just like all other waiver enrollees, to ensure that services continue. And they have the choice, just like everybody else, of either the more comprehensive health home care management and the basic HCBS plan support. So yes, they can make that choice. I think people need to be very clear about the scope of services that are available under the two models, and to make sure that that's the appropriate choice for them, given that self-direction can frequently require more support from a care manager. And in fact, when we looked at the design of the health home service, we did make sure that that was one of the factors that would be looked at in terms of making sure that there was appropriate care management for individuals who self-direct. So absolutely, the choice is there, but it is a choice that should be carefully considered.
Do all CCOs provide the same services, or do they provide different services?
So all CCOs, care coordination organizations, are delivering health home care management and the basic HCBS plan support. Just like today, you have many MSC agencies, they are all delivering MSC services. It is the same service, it has the same requirements. However, there's likely to be differences between CCOs in terms of what they bring to the table, but they are all delivering basically the same service, and it is a higher level service that we hope will be a very positive force in making, helping people get better services and more integrated care. So we're just going to take a quick scan through the questions to make sure we've identified any of the more frequent ones. But I do want to make sure that people are thinking about the frequently asked questions and take a look at it. It is available, and I think it's a great resource. And as we said, we will also have the resource guide available for people by the end of the week, and that is a terrific resource as well to help service coordinators navigate the enrollment process with and for individuals. All right, sorry to delay everybody. We did want to go through the questions. I think we've hit on most of these. Many of the questions that were asked today are in the frequently asked questions document, so we certainly want to direct folks to that. And I want to thank everyone for taking time out of your day. We appreciate your participation in all the great work that's going on to help individuals and families navigate this transition. We think that you all are doing just yeoman duty there, great job, and many, many thanks from all of us here. And we look forward to really helping develop a great care management system for the individuals we serve. Thank you.